Well, good afternoon, good morning, good evening to all who have joined this webinar. And if you're watching on our YouTube channel, lovely to see you. Hope you enjoy this webinar. My name is Nick Richmond. I'm a director of Tricordant, and this webinar is AI Enhanced Organizational Design. And today we're going to be focusing on health and care. Now, Tricordant is a leading organizational consultancy. We work in partnership with our clients to co-create healthy and sustainable organizations, making a positive difference to society and supporting leaders to be the best versions of themselves. I'm joined by colleagues and my friend and colleague from Reconfig, Tim. Tim, why don't you introduce yourself?
Thank you, Nick. My name is Tim de Boer. I'm the CEO of Reconfig. We are a platform for AI-powered organization design. That means that we leverage AI in the design process, but we also create target operating models that are AI-powered. I'm delighted to be here. Nick will do the introduction and the theoretical background and the practical consequences, and I will show you the actual platform so you get a little peek into how the tool actually works.
Yeah, thank you, Tim. So as you can see, we're going to go straight into a bit of a poll and then a bit of a provocation. As Tim says, I'll cover some of the rationale for AI Enhanced Org Design, and Tim will demonstrate the approach. We'd love to hear all your questions about this. Do drop them into chat as we go along. As they come to mind, just drop them into chat. We'll try and pick them up as we go along. If not, we've got a panel discussion where we have a bit of a Q&A around that. And then stay for the end where we can share how to get started within your own organization. But a couple of offers first. Do book a meeting with us before the 31st of January. The offer is we'll create a digital twin of your organization. All we need is some light touch of information. That is the purpose of your organization, the strategy, and the top 2 levels of job titles of the organization. Now, maybe you don't want to look at the whole, but just a part of that, maybe a business unit. That's the same information we'll need just for that business unit. And from those 3 simple pieces of information, we'll be able to identify where there are opportunities to bring in artificial intelligence to really improve the productivity and impact on your operating model. In one instance, we found that 46% of head office roles could be automated, retrained, and redeployed to focus on other strategic initiatives. The second offer is if you want to learn how to do AI Enhanced Organization Design, then we are putting on some training in January. We'll be delivering this on the 28th of January between 9 a.m., it says 9 p.m., but anyway, 9 a.m. until 5 p.m. And what you'll learn there is to assess the full AI potential of your own organization. So you'll be working on your own stuff. Each person will be working on their own organization in that training session. You'll also learn how to redesign your organization to enhance productivity while creating meaningful jobs for your own people, and then to leverage the power of AI and the creativity of your people to scale the transformation successfully. Now, to segue into the provocation, I want to start us with a poll, and there's a question here. How frequently are you using generative AI? Now you can see that 25% of people who've responded are saying frequently, which means that 75% are only occasionally or not at all. So it's really interesting to see that and see how that compares versus other polls that we've done in various webinars. So other polls have had a number of people in the very frequently and frequently category. So really interesting to see that. Thank you. Now, Microsoft did its own survey in this space, and they surveyed about 31,000 people across the whole of the world, and they covered multiple generations, different countries, and so on. And the conclusion from their survey was that AI at work is already here. And what's driving this is that people are saying that they're struggling with the pace of work and the volume of work. They're feeling burnt out. They're saying that for every one email that they write, they've got to read 4. And when you look at it, knowledge workers are saying that they're already using generative AI. They're reluctant to tell other people about it. They're using their own AI tools. And of course, that generates questions around safety, around security, around good practice. And leaders are saying, well, they're worried that they lack a plan and a vision to implement AI. And that's where Tricordant and Reconfig come in, where we can help leaders to identify where to prioritize their efforts and how to create an integrated AI at scale. From our research, we found that there's a number of use cases across the whole of health and care. And the top ones are these 8 that seem to be really present. And that's around remote monitoring. So this may be where you have a wearable device or something that's inserted in your body for vulnerable individuals and alerts clinicians and caregivers of potential health concerns in real time. Or maybe it's real-time tracking and predictive analytics for public health. We saw that in COVID times, actually. There's a website that we could all go onto and watch as COVID moved across the UK, and maybe even seen the different variants of COVID being present in our region or within our county. There's medical imaging and diagnostics, whether it's radiology or like MRI or X-rays to detect things like cancer, heart disease, fractures. And so there's a lot going on in that space. And I suspect we've all been Googling and looking that up. But there's also process automation and documentation. And I'm going to come to one of the jaw-dropper examples in a moment. Virtual health assistants is another one. These could be chatbots and virtual assistants providing 24/7 access to healthcare advice, helping with appointment scheduling, symptom checking, and that kind of stuff. That also leads to precision medication and personalized care, where AI customizes treatments for patients' genetics profiles. And that's where genomics is starting to get into things and helping people think about what are the right therapies for treatments in oncology. Operations and resource management. This is true both within the hospital setting, but also within the social care setting, making sure that the resources are in the right places at the right times. And then, of course, clinical decision support systems. Some jaw-dropping examples include 44% improvement in diagnostic accuracy. So this is AI algorithms at scouring MRI images of the brain to look for subtle neurological changes over time. And this has been able to improve diagnostic accuracy with patients with multiple sclerosis by 44%. That reduces, that also helps to reduce the reading times. Another one is 73% reduction in patient waiting times for GP appointments. So if we think about that, I don't know if you've experienced it. I certainly have with my children, the 8 a.m. rush where we're trying to get a call because my child overnight has come down with some rash or something's going on and we're trying to figure it out. But really having AI powering those triaging systems really helps to reduce that. And if you're able to scale it up across the whole of the NHS, they identified in the last year that there's 350 million GP contacts. Now, if we could say that 73% of them could be automatically allocated without staff intervention, that could have a huge impact. So that would be 320 million of these that could have a huge impact on staff capacity. AR receptionist is another one. And the pilot in Mid and South Essex NHS Foundation Trust reduced those did not attends by 30% over a 6-month period. That meant that an extra 1,910 people were seen, and that forecasted the trust to save about 27.5 million in a single year. Again, imagine if you could extrapolate that across the whole of the NHS. The last one of these jaw-dropping ones, and there's many out there if you haven't been Googling them, but do check them out. Kingston Council could potentially reduce their social worker time writing up assessments and case notes by up to 50%. And that was using a particular tool. They also noticed that they could really save a huge amount of time in supervision write-ups, where it normally would have taken about 40 minutes to do that. It was able to reduce it down to 10 minutes using transcriptions of those meetings. Now, people are worried about accuracy of these meeting notes, and the project team initially aimed for 85% accuracy, and the results actually yielded 96% plus. So these case studies prompt the questions: where are you on your AI journey? Are you keeping pace with peers? And how do you go from individual use cases to an orchestra of AI and people creating a symphony of value together? Now, I'm an org designer, and when I think about organization design, it's ultimately about division of work and integration of effort. Now, if you think about a breakfast experience, I like to have eggs, bacon, some hash browns, maybe a glass of orange juice, some beans, that kind of stuff. What I want is for all of it to arrive at the same time, all hot, all ready for my consumption, and that's a great breakfast experience. But if it comes with eggs initially, then maybe some bacon later, then maybe the orange juice right at the end, I'm not really having a great breakfast experience. And the same goes for designing an integrated operating model where AI and people work together to create that symphony of value. The last thing that you want is AI and people playing different tunes at different tempos and different keys. There must be alignment and coordination, otherwise complexity and variability rises, leading to waste, frustration, inefficiency, and loss of trust. So if you've read Lord Darcy's report and West Treating's proposals, then these challenges here on the slide won't be a surprise. But as you can see, AI and people working together in symphony can mitigate, if not resolve, these challenges really well. Now, Tim, do you want to share a bit more about these benefits?
Thank you, Nick. So what we see is that well, actually, I studied computer science a long time ago, and at that time we already predicted that AI would change the world, but it didn't. But nowadays, when you look at this screen, you see that many things are actually happening. It may look a little bit overwhelming if you're in charge of a hospital or a clinic, and where you're going to start and what you're going to do. So this session is really about making it practical. But just to look at the big trends, what we see is workforce shortages. You need to have your people at the right moment at the right place, and that means that you need to predict. And you can use AI, a predictive analytics model, for workforce planning, both operational and strategic workforce planning. Evolving patient expectations. Patients are also consumers, so they buy from retailers, they book flights, etc. And they're used to a journey nowadays which is different from the past. They expect the organization to know a lot about them, to help them, to give the answers on the spot. So the bar is higher than it used to be. So this is expectations. That's not true for everybody, and that's a responsibility for those that are responsible for health. Some people are left behind, and also those people have the right for to adequate health care. And AI can also help here, and we all have heard about the AI bias. So, but it can also sort out if you have a large population who is at risk, and use it for the better. A big enemy of AI is, of course, the fragmented data system. But again, AI can also help to consolidate data sources. So if you have fragmented databases throughout your whole organization and even externally, it's nowadays very easy to integrate and have a consistent overall look at individual patients or trends. Increasing demand is something that we'll be facing as human mankind because we all grow a bit older. So we also need to upgrade the productivity. Otherwise, it's no longer affordable. So I will also show you a lot about productivity gains. And it's not just reducing the size of your organization. It's more about freeing up people to do meaningful roles and let the AI do the things that it can do so that people can more interact with other people, mostly patients. And we see a big shift around preventative care. So we all grow older, but the last part of our lives is not always the most agreeable, most enjoyable one. So it's all about the extension of the healthy lifespan. And AI can help you with personalized care. So I may need to have an apple, and Nick may need to have an orange, but it's really about what is needed. Do you need an aspirin, or do you need something really that's more intrusive. But it's different for everybody. Now, this is a big paradigm shift for healthcare, like each of those that are on the screen. And it's not just about technology, it's mostly about how people are working together to provide the best healthcare. And that's organization design. So next slide, Nick. So Nick and I talk a lot about mission-driven organization design. So it all starts with a compelling vision. So it's about co-creating a compelling future and creating a digital twin to explore the future scenarios. Now, what's a digital twin? That's a replica of your organization. Maybe you're familiar with digital twin of a factory or a nuclear power plant, but nowadays we also do organizational digital twin. So that enables us to create a target operating model of your organization. And we are, and I know Nick as well, we are big fans of idealized design. So it wasn't possible in the past to create an ideal state of your organization, but nowadays it is, and I'll show you how to do it. We're using synthetic data with non-existing people, but they fill the roles in your target operating model. And now you can talk about Jacqueline, for example, who could be the managing director of a hospital, and I'll show you her in a moment. So this is all about the target state, so the to-be state. Then we look at discovering the current state, and then of course we do the gap, and that requires a roadmap, bring the long-term vision to life. So you go from current to target, and that's this roadmap. And as Nick always is saying, we're talking about orchestrating an AI, AI and people. So generative AI agents and people dividing the work. So that's joint value creation. Next slide, please. So here we meet Jacqueline, and she's the head of the St. George's Hospital, the chief executive officer. So for demo purposes, we created a simulation of this St. George Hospital in London. And we're using synthetic data to represent 58 management roles, overseeing around 9,000 full-time equivalents. And that's a total work capacity of around 1.5 million hours per month. We calculated that 456 hours per month can be freed up through implementing AI, and that's 24%. Now you hear a lot about it can be 20%, it can be 60%, lawyers will become obsolete, doctors will have a different role, etc. But it doesn't mean much if you don't know what to do for your own organization. So we are really talking about a model with people and activities where we can explore what is the potential of AI. So I'm gonna now take you on a journey in the actual tool, and you are gonna see now Jacqueline again. But now you can also see that she's overseeing here 9,325 people. And we've built this using artificial intelligence as well. So as said, it always starts with the mission and the strategy. So how did we build this whole thing? You can see here that there are direct reports, etc. So here you can see that it's quite a deep model. But how did we come to this? We start with define, and that's including the mission statement. So what we did is using publicly available information. I didn't do any interviews with St. George's. We only used what's publicly available. So that's also why it's not confidential, and we can talk about the hospital. So St. George's Hospital in London is one of the UK's leading teaching hospitals. Around 9,000 staff, 1.3 million people serviced across Southwest London. Mission is to provide exceptional health, compassionate, inclusive, innovative, dedicated to advancing medical knowledge, education, and research. Together with staff, students, partners, strive to improve health and well-being of communities. Specialties, cardiovascular, neuro, trauma, renal, cancer care, emergency. So this is basically capturing the mission. Now, we bring the mission to life through a strategy, and I'll come to organization design in a moment, but we take this intermediate step, looking at what we call the strategy diamond. So there are 5 elements of a strategy. It's about the business domains in commercial terms, but for the hospital, it's like where you be active in which areas of medical practice. It's about how you'll get there. It's about how you would win in the marketplace, but that's like how you position yourself as a hospital. Steps you need to take, so that's the staging, and then there is the economic logic. All of this is generated through the AI based on publicly available information. Now, if anybody's in the room from St. George's, then please raise your hand and tell me that maybe the AI is wrong. But I would then immediately say, well, it's only based on publicly available information, so you might have to update the website as well. So what we see here is that it's focusing on trauma care, continue to enhance and expand services in major trauma care. It's renal and nephrology services, etc. And here you see the partnerships and the alliances, and here you see excellence in specialized care, patient-centric, etc. This is building an organizational digital twin based on the mission and the strategy. And then the first thing that you would do is create, based on your mission and your strategy, the design criteria. So what are the criteria that your organization design should meet based on this strategy and this mission? Well, the organization model should prioritize patient-centric care. It should facilitate the formation and maintenance of strategic partnerships, and so forth. Now, these were generated through the AI. You can override them. You can put your own design criteria in place. But a very neat element of AI is that it can also check itself. So you can do an evaluation based on the mission and the strategy. So looking at those design criteria here, the AI has just found that the alignment is pretty good, but it does not currently cover certain elements. So here it says technology integration, which was something in the strategy, is not covered so well. So it now proposes to say the organizational model should integrate advanced healthcare technologies to enhance patient care and organizational efficiency. So I can add that one. If I press this one, it's added to the design criteria. The design criteria will be later used in the evaluation of the various scenarios, but we take a few steps to get there. We first are going to look at the configuration, and that's about forms and orientation. So those that are fans of Mintzberg will recognize here, we used to call it the simple structure. We now call it the entrepreneurial organization, the machine organization. Typically, a hospital is a professional organization where you standardize based on training. You can change this if you say, well, I would like to be more of a machine organization, but currently the system is building a professional organization. And the orientation is a hybrid between function and maybe product. And product in this case is the various disciplines. Based on this, we create the functions. So that's what the organization should be able to do. It creates the high-level units. It creates the authority metrics. And we do the roles and the role allocations. Ultimately, we have the org chart. And then we come to the evaluation. So we create various scenarios. But before we do that, we go actually very deep into the organizational digital twin. So now we see that lady again, this chief executive officer, Jacqueline. In reality, she doesn't exist. This is synthetic data, so generated as a profile by the AI. But what she's actually doing is a set of activities. So she is the CEO. There's only one of it. So I got FTE here equals 1. What she's doing is here, she's working on collaboration and partnerships, 30% of her time, sustainability, 20%, transformational programs, community impact, etc. So typical C-level activities. Gets a bit more interesting if I go to somebody that's working in here, renal medicine. And here we meet Chloe, and she is a dialysis specialist. So what she does is 80% of her time she's in renal medicine. The interesting thing is that if we want Chloe to be augmented in her, by the way, Chloe is just one person in the thing, but I have set her 200 FTE. So whatever we do with Chloe, it will be multiplied by 200, and that's important for the analysis later. So Chloe is working in renal medicine. That means if you look at the activities, and the activities are here, I need to change the slide, the screen a little bit to make it more readable. Sorry for that. Make it a bit more so you can see it hopefully at home as well. So we can do the outsourced, but we're focusing now on the automation potential. So let's look it up. Here we have patient care, renal medicine. It's a strategic activity. And what it does is managing kidney-related diseases through transplantation and other therapeutic interventions. The system says it can free up 40% of the time of anybody working in this role. And then the question, of course, is why is this 40%? Well, it's because renal medicine involves complex decision-making, patient interaction, and personalized care, which are difficult to automate, while certain aspects like data analysis and monitoring can be supported by AI. The hands-on nature of dialysis, transplantation, and therapeutic interventions require human expertise. So therefore, it's relatively low, like 40%. You can change it. You can say, well, we now have something very innovative and it can be 60%. You can also keep it more conservative at 20%. But based on the synthetic time utilization in that organization, it translates to 33,380 hours per month. Now that's quite a big number that you can free up. So we had 200 FTE set to Chloe, which is the persona that does this. Then we go to the AI agents, and then we say, well, let's have a look at renal medicine. Let's have a look at the team that does this here. And now we find Chloe again, and we see here that there is a total work involved of 25,600 hours. So that's the percentage of those people that are actually working on renal medicine. She's also doing some other stuff like social and community, but this is the number of hours we have here. Now we can free up 10,240 hours. So we're going to generate a colleague for Chloe, and that's a patient care renal medicine generative AI agent, and that can free up 10,240 hours. What is this agent going to do? Well, we're going to create task suggestions. So now the AI is looking what potentially AI can do. So here it says patient data analysis and monitoring. So the generative AI agent will analyze patient data, including lab results, medical history, and current treatment plans to identify trends, potential issues, etc. So this is taking very data intense work out of the hands of Chloe and put it in the hands of the generative AI agent. Now, this is just one example in renal medicine, but this is how we come to the total AI potential of the 350,000 hours out of the 1.5 million hours that's at the disposal of the hospital. And that means that in this particular case, we are looking at 24% of increase of productivity. This is just an example of a very quick build-up of an organizational digital twin. But as Nick was saying, if you're interested, we can do this for your organization. And we can look at what are the consequences of freeing up the labor and creating more meaningful roles for people that can then focus more on the people-oriented tasks. I can talk about this for days, but Nick, I think it's time for you to take it back.
Yeah, thanks, Tim. And it's of course it's just important to note that the tool on its own is just a tool. You've got to work with people, which is why we talk about human-centered organization design with AI there to supercharge it. And we'd love to hear people's questions of what's provoked them through that conversation, through that presentation that Tim's done. But one of the things is also to remember to note that as it is human-centered, and there you probably saw it within the tool itself, you can actually update and improve the quality of the data that it's gathered. So some of the data it's gathered from open sources, other data you can upload from your internal systems, so that you have a much more accurate example of your digital twin. And that allows you to run different scenarios and to think it through. Now, of course, one of the common questions that comes up is, well, are we just designing people's jobs away? Now, Tim, I don't know what your response. What would you say to that?
Well, we are living in a time where we don't have enough people to do the work anyhow. So it's all about freeing up talent. But it requires transforming the organization, just like you said in the very beginning. It's not technical. It's really organizational. It's really finding meaningful jobs and reorganizing. You personally experience probably in productivity gain using ChatGPT or Einstein or Gemini or what have you. But it only works if you can meaningfully fully reallocate that time. And that's a big task for those that are in any position of authority in healthcare or any other industry.
Yeah, yeah. I'd also add in that when I've looked at different organizations and how they're responding when they're implementing AI, there seems to be three types of responses. One is a response around replacement, and there's some lessons to learn from that. I'm going to come back to that. There's enhancement, where they're enhancing the people able to do things quicker, faster, dealing with more complex issues. And then there's also retraining, and the retraining one I think is really inspiring. Was IKEA is the one that I actually came across quite recently, where they had 8,500 of their people that are on the customer service side that were put at risk, and they said, well, hang on, we like our people, we deliberately employed them because we like them. Why would we want to get rid of them? So they invested in their training, and they helped them to move into different parts of their organization. And they've attributed that 1.4 billion additional revenues added to their bottom line. So they're very pleased with that. Coming back to that one around replacement, there's a financial services organization that thought that by implementing AI, they could reduce their staffing by 50%. And they were able to do that. And they're also able to improve their numbers, and they look good on paper. But I could just imagine what the people left behind were feeling about that approach to organization design, and whether they're feeling as if they weren't being valued, or whether it was just a matter of time before their jobs were up for replacement. Now, when you look at what's happened to the people that left that organization, there's some research that identified that 62 startups were spun out of that one organization. People had learned how to use artificial intelligence, really clever people, lots of corporate memory, all walked out the door and set up their own organizations. Now, that's a real loss of talent and potential in my mind. And I wouldn't be advocating that, really. I'd be thinking, why couldn't they've become like the next BASF? If you don't know what happened with BASF, is what they did with all their researchers is they'd allow them to research almost any area that they found of interest. And they'd take them through a dragon's den approach to identify those most beneficial and scalable ideas, and then to scale them up. And sometimes they'd sell them off. Other times they'd keep them in-house because they're aligned with their strategic initiatives. And others were they did a management buyout of some sort. So there's real value created through that process. So I think there's different responses that organizations could take to artificial intelligence. And I think reducing people is probably the least of the options of them all. Other question that seems to come up around this is, a lot of organizations are experimenting here and here. They may have let's say, a digital imaging AI. They may be in one part of the organization, and they've got maybe some type of chatbot in another that's responding to queries. But how do you kind of go from those individual experiments to an orchestration of an integrated operating model of AI and people generating that symphony of value together?
Yeah, so there's nothing wrong with experimentation, but ultimately it helps if you have a vision on where you want to go. Now, if you let like 1,000 flowers blossom and then you look back and you say, well, let's see what's gonna get us there, you might succeed or you might not. But it helps, at least if you're in a CEO position or in a senior management position, if you have like a vision of where you want to go with your organization, where you think you can make the biggest difference. And that's what we call like mission-driven organization design. So really, you're talking about purpose-driven high performance, but that means that you need to have a picture in your head or a mental model, and we call it an organizational digital twin, a target operating model. And it helps if you know how you're gonna develop. It helps with many different things. It helps with strategic workforce planning. It helps with your technology roadmap. It helps with many different things. I think it's something that we can do now, and as I showed you, in a very detailed manner. It used to be a PowerPoint where you would say, okay, it lives in the drawer, but now you can bring it to life. And this Jacqueline person and Chloe, who were the dialysis an analyst and the CEO, you bring it to life. You're really doing that ideal situation of your organization. And once you have that, it becomes a magnet. It's the roadmap that Nick is talking about. It's going to that ideal state, and it's still a journey, and you won't get there like next week. It's organizational development more than organizational design. But as leaders, we need to ultimately have a picture where we want to go.
Yeah. So it's that holistic picture, and then a roadmap that allows you to kind of get from here towards that direction. Now we know things change over time, but at least it gives you that direction of travel to move towards. I see Nicole's got her hand up. So Nicole, do you want to come off mute and you've got a question?
Well, it's more of an observation, and Tim's probably beaten me to it actually. Because as I was sitting and listening to the story, and there's a bit of me thinking, wow, and there's a bit of me thinking, oh. And I suppose I'm minded of the need for that org development overlay to support this journey as well. Very minded that we can get seduced into the neatness of sitting behind us, our PCs. Get seduced into thinking about what the future could look like, and then we get brought back down to earth because there is a very complex, messy reality, which is very much defined by how we've educated people, like that whole thing about role identity, the stories and the framing that we use for this, because in my last organization, I was very minded that, and I called out, can we be careful about the use of taking grunt work out? Because I would be talking to the people for whom, they took a great deal of pride in high volume, simple tasks. They'd done it for a long time and they did it very accurately, and their role identity was very much tied up with this. So to have somebody kind of parachute into the organisation, talk about, oh, we can remove all of this. Yeah, I'm not saying that isn't possible, but there is a nuance and a skill and a capability that you need to apply to enable that to happen. And actually, the one thing that I noted, Dan, that didn't show as much in the example that you offered was actually quality and accuracy. Yeah, in a patient, in the kind of diagnostic phase of working out what's the matter. So I heard recently on the news as well, like breast screening and mammography, AI taking a look at that increased the accuracy. Yeah, compared to a human looking at those things. So Yeah, those are my reflections. So the other D as well, it's like two Ds coexisting on this for me. Thank you. Really interesting.
Yeah, that's a really great point, Nicole. So what we certainly want this approach to be used like is more like a like Gervais Bush talks about generative imagery. And you kind of want the Reconfig platform to be a generative image, something that stimulates discussion and dialogue amongst the stakeholders that are involved in the conversation. So you can then work through the nuances and make some decisions. I think often that can happen just by accident, and rather why don't we be more intentional about that and bring it in and say, well, look, this is what the implications could be if we go down this route. How do you want to handle that? Let's think about who you're looking to employ, and there's many people in employment who have different abilities, and like you say, that some people have a real identity connection with the work that they do, and if we remove some of that work, what is the impact on people? So we've just got to think about that carefully. And of course, as everyone knows, we seek to design healthy, high-performing organizations. And so we want to kind of create that organizational health for all people in the organization.
Yeah. So Nicole, really thank you, because we need to be humble as data scientists, because we cannot be better than, as Nick says, a provocation, a tool that can inspire, but ultimately it still stays a profession, an art, and a craft to transform organizations. Now, in an ideal situation, it goes hand in hand. I always say Reconfig is like a hammer, and then Nick would be a carpenter, and the client needs a new house. Now, if you don't have a hammer or you don't have equipment, it's very hard to build a house, but it's not enough. It's not like the hammer is going to build a house for you. So yeah, thank you for pointing that out.
Another question I think that does come up occasionally is well, is it better to kind of design from the future backwards, or should we kind of understand what our constraints are and then kind of move ourselves forward on that? Don't know if you've got some thoughts in that space, Tim.
Yeah, so the way I describe it today is really a linear process, right? You have a mission, you have a strategy, and then you have the functions, the design criteria, and ultimately you come up with an idealized design, and then you move towards there. Now, sometimes people say, well, I have a current organization and I would like to start with that. And both are fine. So you can also say, what could be my strategy given the fact that I have certain capabilities? It's not the common textbook approach in strategy lectures at universities, etc., because typically you go based on what you want to be, and then structure follows strategy. But in the organizational digital twin, you could work the other way around. You could also say, like, we start with modeling the existing situation, and then the AI can figure out a few alternatives for what you strategically want to be. Do you want to be a general purpose hospital, or do you want to focus on certain specific areas and partner with other hospitals in the region that they can do the other things? So you can work backwards. That's actually a very interesting observation. And it could be in the past also, but then it was really high level. So all PowerPoint reports and drawers. But now you can be really specific with this data-driven approach.
I'm just wondering if there's any questions from the audience. If you want to come off mute, or if you prefer to type into chat, by all means type into chat and we'll read them out. But any questions on what you've heard, or what's prompted in your mind? Maybe it's an application, maybe it's an example from your own practice that you'd like to think about and explore. John, do you want to come off mute?
Sorry. It's a quick one really for Tim. So AI is obviously trying to, or will take us into the future, and we've got all the stuff, and it was on the slide that Nick did about, you know, the future is here and what have you. So, but if AI is researching, for example, to set up the digital twin, it's looking very much at the current or even the past history. How do we get sort of AI to sort of kind of, or are you already there in terms of getting the AI to leap forward, and if it's coming up with the sort of figures that you're showing, how does it start to say, okay, well, if we get to that, how do we make it even better? If I'm making any sense, it's just something about how you work in the future today when you don't know actually what the future necessarily holds, but you're still doing predictive modeling.
So we are almost entering the domain of science fiction and futurology. But as a mission of I think Tricordant and also Reconfig, we want to make it real. So we don't want to go too far overboard with general artificial intelligence, because for the foreseeable future, AI still has limitations. But having said that, within the limitations of what it can do many things that it's better at than human beings. And now it's a responsibility of leaders supported by people like us to find those spots where you can have better patient care, where you can have higher productivity. And these are all solutions that currently exist. Now, of course, we can also do workshopping and then think about the fourth industrial revolution and where it's going to get us, and take it like a few steps higher. AI can also hallucinate sometimes. So I don't see a foreseeable future where a patient is arriving at hospital, there are no people, and it's all done automatically and you leave as a healthy person. That's maybe for like generations to come, where you can heal using robotics and all of that. We are talking about reality now, 2024. What can AI do to increase the productivity of your staff and enhance the treatment of the patients? And that's really where we currently, and that's already a very big step now. Does that answer your question, John?
I mean, it answers it as much as there was a question there even to answer. I mean, it's just sort of musings about the whole thing, isn't it? Really, and where this might go, and the foundations that it's built on.
Though I do know that there's a game played across Asia called Go. It's a fairly complex game, and people never thought that AI could actually learn it because they thought it was too complex. We all probably remember many years ago, back in sort of the 1980s, that an algorithm, really, a very simple version of AI, could beat a person at chess. But they thought Go was far too complex and you couldn't do that. But in 2015, not only did AI beat the world champion in Go, it invented a move that no one had ever thought of before. And Go's been played for thousands of years, and no one had come across that move before. So there is the opportunity that teaching AI the rules, in essence, and how to do things, that is able to then see beyond the rules and to find ways forward that maybe astound us. So I know that there's lots of big organizations already investing in that space. And at a pharmaceutical conference a few weeks ago, the chief executive of DeepMind was talking about virtualizing a human cell so they could have their virtual R&D assistants constantly interrogating this virtual cell with different molecules to see how it would interact with those as part of rapid clinical development. So there's a lot coming. I suspect we're going to get some astounding leaps forward in the next few years, and I think that's going to be true not just in medicine, but across the whole healthcare. Tim.
Just building on your example of Go, and it's getting a little bit technical, but apologies for that. So it's all about large language models, right? So the human champion, Go, he lost against the first version of the artificial intelligence Go player. But that artificial intelligence Go player lost a 100 time against a 100 times stronger AI player. And what did they do? Well, the first one, they were feeding all the games that had been played in the world for the last 10 years, and it was learning from it, right? But then they said, well, stop it. This is helping, but it's not transformational. So what it then did was it told the AI to play against itself. And that was what Nick is talking about now. And it's a mind-boggling. I think it's on YouTube or on Netflix, and there's a very nice documentary. But it's so interesting to see that human mankind can give the training data in the large language model based on historical data. But it can also say, and the creativity still sits with the human, right? Because the human has to think about, okay, now I'm going to give an instruction. We would call it a prompt with OpenAI, but you can give instructions to the LLM. So the trainer is still very important. But it was a huge difference when we told the AI, when people told the AI, you're going to play against yourself, and you find out, and we're not going to train you even anymore. You train yourself. So to John's question, this is taking AI to a next level. And if you want to research the patterns of cancer cells or nephrology or anything, you can find these patterns now by giving some freedom to the AI to do its own fact finding. John.
I think that's kind of where I was going in my thinking, and hadn't explained it anywhere near as clearly as you did. Which is, how do you get AI to improve AI rather than historic human stuff?
It leads to all other kinds of questions as well. So typically, if you're a young doctor, you need to do all the nitty-gritty work, and you're supervised by an older guy or girl, and then you grow up the ranks. And now you have that knowledge, and that knowledge goes into the AI. But what if all that work that the juniors can do could be done through AI? How are we going to build an organization where we lost the opportunity for young people to be trained at jobs? Because if I'm a surgeon and I'm in a hurry, I need to be productive myself. I don't have time now to tell somebody that's going to make mistakes. I simply offload all those tasks to the generative AI or to robotics, etc. But that means that for the first time in human mankind, we have an option for a senior surgeon to say, well, I'm going to use the juniors and I'm going to build the future, or I'm going to be more productive myself and I don't need those juniors anymore. But that leads to all HR questions. How are we going to build the future expertise that we do need even to oversee the AI?
Sorry, without hogging this, but I don't see anyone else asking any questions. But I mean, it's got huge potential in sort of planning and designing hospitals, for example. And not just patient flow, but one of the big things at the moment is that there's not enough skill in operational managers. But AI can put that in place, can't it? Or at least I would imagine. I shouldn't that it can. That actually you could run, very effective patient pathways that are led by AI rather than the operational managers, or you use that to upskill them. So I could see that there's huge advantages in the future there of just thinking about that beyond the organizational design piece that obviously we're talking about today.
But everything has consequences, and it all is still human beings making ethical decisions and looking into the future, and not just blindly automating everything that can be automated, but really thinking about what's the best division of labor between generative AI agents and human intelligence.
Yeah. So, and that kind of rehearses the conversation that we heard earlier in Nicole's question about nuance and making sure that we're looking at things holistically and designing an organization that we're happy with and we're proud of. Nicole, you got your hand up again.
This takes me back to a conversation I had with the director of finance I think it is connected, but I remember having a conversation with he was a good colleague. We got on very well, but I felt I gave him a bit of a run for his money, or at least he complained I gave him a run for his money. We were facing issues about the estate, and the solution to more people with smaller desks. And I remember saying to him when he came round with the head of estates measuring up, I said, "Oh, I'm interested to know what's happening." He said, "Oh, well, we're downsizing the size of the desks." And if you know me, I use a lot of paper actually. As much as I like the technology, I also like the paper and a pencil. And I said, "Oh, help me to kind of understand what this is about." "Oh, well, we need to get more people in the building." And I said, "Oh, so if we downsize the size of the desks and we get more people in, are we not creating other issues for ourselves?" And he like looked at me and he said, "Well, legally we can go down to this desk size." I said, "Oh, but sometimes you don't want to go as far as you were allowed to go because you're going to kick off with the consequences, no?" And he said, "Well, Nicole, we are going down to as low as we can go." So they went and ordered these much smaller desks. And a little while later, somebody started walking round the office because we had then to invest in partitioning and soundproofing arrangements. So we had to kind of redefine the what the office looked like, because people were worried about the amount of sickness and absence, or people not wanting to come into an office environment that was really loud and noisy and you couldn't concentrate. People were experiencing feeling very hemmed in, and the language of the battery chicken started to enter into organisation and office life. So I suppose I tell that story because I do think it's linked. Careful what you wish for. Just because you can doesn't mean to say that you should. And I think it speaks to that nuance of what are we working in pursuit of here? And you need peripheral vision as much as you need kind of like eyes front.
Yeah, no, good point. Thank you, Nicole. It's a very important story to hear. Now, people often ask, well, how do I get started, and what should I be thinking about next? And as we said before, organization design is an approach that's rooted in strategy. So really think about your strategy and think about what's going to be required. Think about where in the strategy you think you really need to make a real difference and impact, and then use that to think about your pilot projects and where in the organization that could be. And it could be on some type of administrative process. It could be maybe in diagnostics. It could be maybe around a chatbot that's responding internally to HR queries around pay and rations and that kind of stuff. Engage your employees early, and you probably would hear me say this all the time, but engage. Always have those conversations, kind of work through the nuance and find out what's going on. And I think Tim said earlier about lighting 1,000 fires and just letting people have a play with AI. I know some very large organizations have bought licenses for each of their people. So they've got Microsoft Copilot, and people are just having a play, working it out. It's kind of building trust, working out the limitations of what artificial intelligence can do, but also probably allowing those users to specify what they think they really need, and how the organization can learn from that. Next thing, probably got two parts to it, data quality, but also the underlying infrastructure to that. As we all know, rubbish in equals rubbish out. So if you've got really good data quality or need to work on that, then really focus on developing great data quality, thinking about the governance, data management of that, but also the underlying infrastructure. Most organizations, I suspect, are using cloud-based AI systems. And so outsourcing that computing, but also think about, like Nicole's just said a few moments ago, you've got to think about the implications of that. Are you going to impact on your sustainability ambitions if you outsource everything to external AI, cloud software, and that kind of stuff. And you need quite a lot of computing power for AI. So it's all of that kind of conversation that needs to be had. Embrace a culture of continuous learning. AI is moving so quickly. You've got to allow people just to have a go, learn from it, try the next model, and equally within your own organization, you need to be thinking about how you constantly change, whether you're using artificial intelligence or not. And the last is just think about partnering with AI specialists, those that can come in and help you think about the whole operating model of your organization and help you think where to prioritize, what the impacts could be, the nuance of the conversations, and to bring that to life and to work with you on that long-term roadmap. So those are probably the 6 things that we'd say that you'd really need to pay attention to.